things I can go.
No. That's seven because you do this.
Turn around, show everybody.
Now come here. Look, come here. Jesse.
How many of you out there have high blood pressure? How many of you really and truly understand what blood pressure is? Blood pressure is the pressure that is exerted by the blood against the walls of your arteries. Now, how many of you know this exact point if you have high or low blood pressure? Well, that's good, because not many people do. On his 35th birthday, Brett Morris, a husky and tan man, after his vacation, had all the right things going for him to be in optimal health. He felt great except for occasional episodes of dizziness and fatigue, which he found very annoying. On that particular day, he was due for a medical checkup, and tolerantly he went and seen his doctor. As part of the routine examination, the doctor took Brett's blood pressure. He proceeded to tell Brett that he had a mild case of hypertension. Even a little hypertension could become extremely dangerous. According to the book High Blood Pressure, hypertension contributes directly or indirectly to about 1 million deaths per year. It affects over 35 million people. Approximately 1 out of every 4 Americans will wind up having high blood pressure. Now, to keep a check on an individual's blood pressure, there's a simple procedure. It's very painless, very inexpensive. It only takes about 30 to 90 seconds to perform the test, depending on the method that you use. Eons ago, the only way that you could check your high blood pressure was to take an old-fashioned sphygmomanometer, roll a blood pressure cuff with a stethoscope, and correctly place it over a certain region of your arm, and listen for the appropriate heartbeats to determine what the accurate reading was. Now, in the technological world that we are in today, we have such a vast variety of automatic blood pressure machines that we can use to keep an accurate read of our blood pressure. One of my favorites is the wrist model that you can just put on your wrist. Unfortunately, that one's not very accurate because it tends to give you a slightly higher reading than what it should be. But the most popular unit is the automatic unit that you place on your arm. My goal today is to explain to you how to properly obtain a blood pressure reading, not only using the old-fashioned sphygmomanometer, but also using a modern-day automatic blood pressure. The first step that you would do when using a sphygmomanometer is, of course, is to gather everything that you need. Of course, you need your sphygmomanometer, which is the blood pressure cuff, and the meter. You also need a stethoscope. Now, the wonderful thing about the automatic machine is that you don't have to have all these things. It's just all in one, and really don't take much time to use. You also find that you have to take and make sure that the cuff is secured on your arm in the correct place. If you don't do this, you won't get an accurate reading. You'll get a reading, but sometimes it'll be higher or lower because you want to have it placed directly over your brachial artery to make sure that we get the accurate pressure reading that's necessary. Next, you want to make sure that the gauge of the sphygmomanometer, if you're using the old-fashioned style, is placed for easy visibility with you within the dial. I know one thing that I had problem with working in the nursing field was the stupid little thing that will fall on the bottom. You can't really read it with your head turned upside down trying to take a blood pressure. So it doesn't work that way. So you want to have everything where you need it to be. Next, you want to make sure that you have your pump valve and that it is in the closed position, and that the cuff properly inflates. Once you get the cuff properly inflated, you want to make sure that you slowly let the air out, listening for the beginning heartbeat and the ending heartbeat. The beginning heartbeat is your top number, as we call it. Your ending heartbeat is the bottom number. We call the top number the systolic, and the bottom number we call the diastolic. Easy way to remember that is S, systolic, super, D, diastolic, down. Now, the wonderful thing about the automatic machines is that you don't have to worry about all these things. You just simply slide it on your arm, make sure it's over your brachial artery, mash the little power button, and it does the rest of the work for you. It's also important to make sure that you keep an accurate record of your readings. If you don't do this, you might slightly forget to take the blood pressure. You also won't be able to answer a lot of the questions that your doctor may have for you regarding your blood pressure. And it is estimated that about half of the nation's hypertensive people are undetected, meaning that they don't know. One problem is that unlike a toothache or a backache, high or low blood pressure doesn't usually produce many symptoms. People may not know that they have either until it begins to cause trouble with the heart, with the brain, or more importantly, with the kidneys. Checking your blood pressure should be a part of every regular physical examination. As we mentioned before, there is a simple and painless inexpensive test that only takes about 30 to 90 seconds, depending on which method you use to help keep a check on your blood pressure. Also, something else that is great to know is that the American Red Cross offers a vital signs course that lasts about 2 or 3 hours and they cover taking your blood pressure of this course. What easier way is there to do this than knowing how to accurately